Good morning. There's been a lot of crying. Tereza is cornered inside the cat carrier. The good thing about a small dog is that it fits in a cat carrier.
But the box is big.
It's big. Guys, we're heading to Ribeirão Preto to take Tereza to the neurologist. Because she took 3 tests and all 3 came back negative for distemper, but she shows the symptoms and one of them is the tic. This tic is neurological in origin. So we're going to Ribeirão to the veterinary neurologist for Tereza to have a consultation with him. Poor thing, Tereza, right? So we can have some guidance, see how she's doing neurologically, and understand what needs to be done. Because we've never dealt with a case of a dog with distemper before. So this is something totally new for us. We don't understand anything about it. Right. We're studying, we're talking to veterinarians. But I think nothing is better than getting the right evaluation. The doctor will assess her case, examine her, and let's go find out what can be done. But we truly hope that this tic she has, she keeps moving her leg and biting at her mouth nonstop. It's like this all day long. We truly hope from the bottom of our hearts that there's some solution for this, you know? A treatment, a medication, I don't know. But that she doesn't have to live with this for the rest of her life. We've arrived here at the clinic. Look at her little tic. Can you see the tip of it moving? That's what worries us, that leaves us full of pity for her. She's scared, poor thing.
Have we been with her for 60 days already?
I think it's been about 2 months already, right?
Yeah, 2 months. When she arrived, she was so skinny, just skin and bones. She looked rough, poor thing. And we ran tests on her at the time.
For distemper.
For distemper normal. She had a blood test and everything.
Because when we got her, she was skin and bones, and she had a lot of discharge in both eyes. A lot.
And then the vet there got suspicious, right? Let's do it. He did the test using the discharge, and it came back negative. He did it using the eye discharge. And it came back negative for distemper, but let's investigate, right, to see if she's incubating it, to check. Her blood test was fine with only mild anemia. No tick-borne disease, nothing. Just anemia. Do you have this first test? I do. All right, cool. Then a lot of time passed, man. She gained weight, you know, got a little body, got cute.
At the time of the test, did you only take the eye discharge sample and not take any others?
The first time was just the eye discharge sample. Then, now that she started with the tick, they did a blood test, the blood PCR.
And then did you only do the blood test, the PCR?
Yeah, blood PCR, and it came back negative.
From whole blood. Is she walking?
She's walking normally. She plays.
She doesn't fall, but her left paw, her neck, her mouth, and so on. Then we gave her 3 doses of problem defense boost from Organite. Organite. Yeah. Another one. What's it called? The treatment, right? Antibiotics.
Doxycycline?
Doxycycline? Yes. There was another medicine we gave her for 3 days. I forgot the name, but I have the prescription.
Yeah, and the injection.
And, oh yeah, Gribelim, you know? We gave her the first dose of Gribelim.
Didn't she have any reaction?
No.
Well, neither good nor bad. She stayed the same.
And she's not taking anything else?
No, she's still taking the antibiotic. It's doxycycline she's taking. The supplements we always give, just regular omega-3 and things like that. As for the pets at home, because she stays in a place reserved just for her.
We have a house just for rescuing dogs, where she lives with her mother.
When we get home, we keep a set of clothes just for going into the garage. Then we take those clothes and shoes off and put on our house clothes. Do you do anything else, like something you recommend because it helps? When you get home to avoid?
Avoid wearing the same shoes, the specific clothes. And I always say, well, when my dog was a puppy, actually even today, I'm wearing different pants exactly because of that. Because I'm going to handle her and then I change everything again. And the Herbal Vet spray bottle.
I didn't know that.
On ourselves?
Since you don't need to spray it on clothes you'll change out of, just wash them as you would with Herbal Vet.
We were only doing it on the floor.
Dilute it properly in the bucket. If you want, let it soak for 10 minutes, then wash it, that's fine. And then to step there, I say, spray it on the mat or leave a damp cloth. Wipe your feet well there. Do a quick foot rinse, okay?
Okay, got it.
And where does she stay? And the others too. You can use Herbal Vet everywhere. It lasts a long time. I've had the clinic here for a little over 6 years, and I'm on my 3rd bottle, and I use it a lot, so it really goes a long way.
You put a little bit in a bucket, right?
Yeah, if I'm not mistaken, it's 1 milliliter for 700 milliliters. So it goes a long way. So it's a disease that can progress very well, but it's also a disease that can change completely. What we have to do now, she's fine, she hasn't had any seizures, nothing happened. So we're going to do our best to provide support so that this doesn't progress.
And is there anything that can be done to help right now, for example, to reduce this tick a little bit?
There are some medications that we use to try to reduce this myoclonus a little, but it's not.
You know, something I even asked the other vet just out of curiosity. You're more in the neurology field because humans are already using cannabis oil a lot. What's it called?
The use of CBD with THC. We work a lot with immune balance so we can stimulate the immune system with the oil. Because we produce endocannabinoids, so we have the endocannabinoid system. Omega-3, for example, feeds the endocannabinoid system. When we supplement it, what does it do? Everyone always used to study the forward pathway, but they had never studied the return pathway, and it works in reverse, giving feedback to restore and maintain balance. So everything that's above, it tries to bring back to normal. Everything that's way below, it tries to bring back up, so it seeks balance. When we supplement, we can improve myoclonus, we can improve the immune system, seizures, pain. In short, we're supporting a lot of systems at once. It's not a miracle cure, but it's a supplement.
Yeah, anything that makes things better?
You remember that today, since it's already approved for veterinary use, it's much easier for us to talk about it now. I can talk about it without risking a lawsuit. But I always say, because in human medicine it's considered the last treatment, and then I ask, why should we leave something that can help throughout the whole process for last?
And it's natural.
That's right. It can't be the only treatment, but it's a supplement. Let's go, right? Let's go, shall we?
Poor thing.
Can you put her on the table for me, please?
We did a DNA test on her to see her breed mix, thinking it would show a good amount of Pinscher, but what came up the most was Doberman. Doberman? No, a wiener dog. What's the proper name for a wiener dog? Dachshund.
I noticed that she's doing it more than usual. Could it be because of the trip?
The stress from the trip.
The stress, the agitation.
She came crying, poor thing. In the little box.
But then does it just get worse, for example, when she wants to come back and relax?
It tends to decrease.
Oh, okay.
So sometimes like at rest, then when she gets really agitated.
When we get there, she's actually calmer than...
All right.
She opened her little mouth.
They do. Ah, princess, I know it's boring, I know. See, that was it. No, he's almost done. That's it. There you go. That's all it was. See, he'll give you a treat. That's it.
She's all covered in paint, poor thing.
Yeah, because they're painting over there. She stays right next to the painters.
She even wants affection from the painters.
That's what you want, right, cutie? That's it. Good job. No need to be afraid.
She's having a little bit of trouble chewing. Just this one, only this one left. You're looking for the treat, right?
What do all those things you did mean?
They're all reflex tests of the cranial nerves. There are 12 pairs of cranial nerves. So they come out of the brain, that's the central nervous system, and then go into the peripheral nervous system. So blinking, pupil vision, smell, sensitivity. There's one that comes here, passes through the heart, lungs, and goes all the way to the stomach. So we do these tests to see if all the reflexes are normal, to check if there's any dysfunction or injury, or where this nerve or these nerves originate, where they exit, or the path these nerves take, so we can see the degree of involvement. Like this, she has reflexes, all of them are present. The issue with myoclonus makes it quite difficult even for her to grasp things, but she has vision, and anyway, all the reflexes are fine. Positioning. You can see that she has to think about it, but I believe it's more because of the myoclonus than an actual difficulty or impairment.
Now it's over.
Of having difficulty doing things.
Poor thing. Ugh, how annoying, right?
Come on, there's a bunch of stuff to do now, right?
Huh?
It's sad. Why do these things exist?
Can I put it on the floor? A little one.
And she's so sweet, so loving.
What upset me the most is that she was getting so cute, and she was only with us for a short time.
Is her mother about the same size and weight as her?
No, her mother is much bigger.
Does her mother weigh about 13 kilos? No.
No, she's heavier. She's about 20 kilos already. Her mother's kind of long and chubby, you know?
So we already know, right, where the dachshund look comes from.
That's true.
Her mother looks like a German Shepherd, that's the truth. It's like her mother is a smaller version of a German Shepherd. Low to the ground, right? She's low to the ground.
Yeah. Wow, what a hyperactive dog.
Look, it's out of 40 from a human pharmacy. This one has vitamin A, vitamin E, vitamin D. I calculated it for vitamin A, so I want a high dose of vitamin A now. That's why we're going to do 40 drops every 8 hours. At first, for 21 days. So, like this, a dose of 120,000 units of vitamin A. But what about vitamin E, vitamin D? Vitamin D, if taken in excess, usually gets eliminated in the stool, and vitamin E is also very good as an antioxidant, and especially for regeneration and support of the central nervous system. But you added Xeniox, which also has vitamin E. That's not a problem. Now I want a really high dose. She takes omega-3. She can take omega-3 in the morning and Xeniox in the afternoon. That's not a problem.
Okay.
And we even have studies with higher doses of omega-3 showing a better response, okay? Okay? So Xeniox is for veterinary use. 1 capsule once a day, initially for continuous use. Which omega-3 does she take?
From Organaut.
Okay, do you give her the whole capsule?
The whole thing. She eats the whole thing.
Or Xeniox could be the same thing.
But that one is 500 milligrams. This one is 1,000, right? It could be bigger.
And can I give these along with the compounded ones that were ready today, right? Is that okay? Is that okay?
Yes, no problem. Yeah, I won't have. There's another one here. There are only 6 pills, but that's enough to run the test. MacroGuard is also for veterinary use, 1 pill once a day, initially for continuous use. Why? Because at least for the next 4 months, we're gonna do it.
Okay.
For her mother, if it gets too expensive because it adds up, you can also give 1 pill once a day because her mother is doing well. We just want to give a little more support, so there's no need to give a higher dose. It comes in stick form. Which are those little sticks?
Cool.
So if you want, don't.
Isn't this one easier?
Yeah. Sometimes there's a disc Vicina here that sells it too. Sometimes it's even cheaper.
I didn't know that. Another tip for today.
If you use the stick,
I think it could be good since she loves treats. Yeah, and that way she will definitely like it. Testia, right?
yeah. If it's in stick form, it can be half a stick. For Tereza. And then if we put
The hard part is, the treats are those Organex sticks. She won't eat them at all.
but MacroGuard is really tasty.
All right then.
Get out of there! Get out of there!
Oh dear, making trouble. Oh, she doesn't care. She likes what she can't have.
You really like to destroy things. Yeah, you like to tear things up.
Yeah, she tore up the whole pee pad.
I know Uncle won't let you, otherwise Uncle will reinforce that behavior.
Yeah.
Yeah.
Toys are scattered around. Ask if she plays with them. She doesn't play at all.
It's because she isn't used to it.
Yeah, she didn't learn. She didn't learn.
So like now it's from the time it's being formed until about 1.5 years more or less is the period of cognitive and emotional development. So everything that happens now can become fixed in her behavioral patterns in adult life. So like anything you can introduce now at this stage, you can firework noises, thunder, rain, anything that stimulates. Give her things to chew on, boxes to destroy, play the noise while it's happening. Because she associates it, because she's doing something good. What she's doing, that's cool. But there's a lot of noise going on, and then she associates the noise with something good.
That makes sense.
So we start socializing her with other dogs, people, and street noise, and so on.